Do not think just because you're in your 20s that you cannot develop breast cancer or any other type of cancer because you're young. Hey YouTube, it's your girl Samaya. Welcome back to another video. I don't know what I'm gonna name this video yet, but basically I am about to go to surgery. I have to be at the hospital in like 30 minutes, so I'm kind of trying to hurry. I will do most of the explaining afterwards, but yes, that is what we're doing, so stay tuned and I'll go more into detail later. Alright y'all, we are here. Okay y'all, I just got checked in. It's pretty crowded in here, but now I'm about to just go sit and wait. Alright y'all, I am back in the room now. They just got done taking my vitals. This is what we're looking like. And now I'm just waiting for the nurse and the anesthesiologist to come back. So, oh yeah, I forgot to tell you all what I'm getting done. So basically I have a mass in my right breast and they're just removing it today. So yeah, that's why we're here, and I'll go more into detail later, but yeah. Look at her. Look at it, woman, man. Look at it. That ain't my girl. That's my nigga. Catch me out on Ocean Drive with her. Catch me in the whip, ride with her. Hey, sipping something, bumping big, hypnotized with her. Pray you get that job in Tampa. That's only 4 hours away. Take a car, take a plane, baby, whichever is faster. Oh. So I took out my nose ring. I'm not taking my septum out. She's gonna go get a consent form for me to sign because I refuse to get that re-pierced. It kind of hurt. I'm not getting it re-pierced if it closed up. It just closed up, so I'm not taking it out. I'm gonna take my belly button piercing out though. When it gets closer to time. But now we are just sitting here and we are waiting until 10:30 so that I can go downstairs, I guess, or wherever I'm going. So yeah. That's the feeling that I get when we live. I got the weed at the crib and the liquor too. Okay, y'all, I am back. My medicine's wearing off now, so I'm becoming a little bit more conscious, but everything went good.
Aztec doing good. SP5, they doing good. 6 straight Z-Tech Energy stocks lead. CSP, Dow Industries.
Okay, well, they just got done unhooking me from all this crap, so now I'm about to get dressed and we're out of here. Oh, you work at Coles, you in dental school. We's out of here. Young Tiller, girl, I'm known as Pink Griffey too. It's only right that I swing by and hit it too. First base, second base, third base. I'm trying to get you in your birthday. Oh, I know these other niggas thirsty, but please never entertain them, cause that would hurt me, you feel me? Feel me? Yeah. I know you feel me. Oh, I know you feel me. Yeah, yeah, yeah. Well. Alright. Hey y'all, it has been a minute since I picked up the camera. The last time I picked up the camera, I was leaving surgery. Today is December 15th, so it's a week later. And I just kind of wanted to sit down and get into the nitty-gritty of how I even ended up in that situation. So let's talk about it. So we're going to go all the way back to about November of 2022. I started noticing some unusual things about my body. I was having nipple discharge that was clear and sometimes red, which is alarming, was obviously unusual. If I had any type of compression on my breast, I was getting nipple discharge. I was purposely squeezing it because I was like, I thought I was tripping at first. I'm like, okay. I noticed that anytime there was compression, there was discharge. So I tried to wait it out for a little bit. I said, you know, maybe, I don't know, that is just something that's happening.
maybe it's no big deal. I let it go on for about a few weeks, maybe. And then I was like, okay, it's not getting better, almost getting worse. I'm starting to have more discharge every time it's compressed. That's the only symptom I had. I didn't have any pain. I didn't have any tenderness, any soreness, anything. It was just discharge. So I went to the emergency room, and they basically was like, there's nothing that we can do to help you. We're going to rule it out as galactorrhea. If you don't know what galactorrhea is, that is whenever you have milk coming out of your nipple for whatever reason that's not due to pregnancy. But this is not milk. This is clear discharge. They told me basically to go to my primary care doctor, or whatever, whoever, to follow up basically. So I scheduled an appointment with my OBGYN. And when I went to her, it was basically the same thing. It was, I mean, she didn't rule it out as galactorrhea, but she was just like, we don't know what it is. That's kind of weird. I don't think it's breast cancer, because if you don't know, and this is what was freaking me out and what made me want to go to the doctor, is because if you look up nipple discharge, clear nipple discharge, like what can cause it, breast cancer is going to be the main thing that pops up. That is like a big red flag for breast cancer, and breast cancer runs in my family. So, and even though I'm young and you don't start getting mammograms and all that good stuff until you're in your 40s, it is not impossible to get breast cancer at a young age. Because I have a family history of breast cancer, that is what made me want to go get checked. And she was kind of brushing it off. She wasn't worried about it, because she's like, oh, you're so young. I really highly doubt that it's breast cancer. She was going to send me on my way. And I'm like, so what do I do? I'm still having symptoms. Nobody's able to tell me anything. I don't want to just leave this alone, because I know my body, this is not normal. What am I supposed to do? Because I told her, I'm thinking it's either breast cancer or intraductal papilloma. And she was basically saying she wasn't sure what it was, or if it was either of those things. She just highly doubts it's either of those things, because I'm so young. And I told her I still didn't feel comfortable. So she said, well, if you want me to refer you to the intraductal papilloma doctor, I can do that for you if it'll like put your mind at ease. I said, yes, please. I don't remember how much later on I was able to get in, but I went to that doctor. First thing that they did was give me an ultrasound on my breast. Gave me an ultrasound. They said, we'll give you your results in about 3 days, whatever. When I got my results back, there was nothing there. So at this point, we're all confused, because we don't know what's going on. They said, well, how about you come back in 6 months and we'll follow up. I said, okay. I booked my appointment. I came back 6 months later, which was in like October or something, or whatever month it was. I don't know. But so I get to my follow-up appointment, and they give me a mammogram, I believe. I don't remember if I got an ultrasound that time as well, or if I just got the mammogram, or if I ended up getting both. I might have got both. But anyways, I know for sure I got a mammogram at some point, which was during the second visit. I just don't remember if I got an ultrasound first. But when I got the results back, there was a mass there that was not there the first time that I went. It was fairly small. I want to say 2 centimeters, a centimeter and a half, something like that. I saw the results in my MyChart before they even called me. So they were like, yeah, we see a mass. I want to say I got another ultrasound, and that's whenever they saw it. And then I followed up with a mammogram. So that's whenever I went in for my mammogram. They took pictures. And then they referred me to a breast surgeon. Actually, I'm lying. I gotta go back. So we got the results, And they said, okay, well, now our next steps is to perform a biopsy to determine whether this mass is cancer, basically, if it's cancerous. Very first time I came, they just said that I had a dilated milk duct with debris floating around. That was what it was. Second time I went, which was 6 months later, they saw a mass, a tumor, and they wanted to do a biopsy to see whether the skin cells were cancerous or not. So I want to say maybe 2 weeks later, I went in for a biopsy. And if you don't know what a biopsy is, it's basically where they take like a hollow needle or some type of device, and they numb you up. I didn't feel anything but pressure. It did not necessarily hurt. It can be uncomfortable though. They just took a few samples of my breast tissue and sent it to the lab to test. So I got my results from that a few days later. They were like, good news. The tumor is benign, which means non-cancerous. So that's good news. Now we're going to refer you to a breast surgeon and basically discuss your options about what's the best approach. What are your next steps? A few weeks later, I go to the breast surgeon, and there's pretty much two options with this, depending on the severity of it. Some people leave it and they just kind of monitor, so follow up every 6 months or 3 months or however long. Or you can get surgery to remove it. In my case, she said, I think it's best that you just go ahead and remove it. I said, I completely agree. Get it up out of here. She explained to me very thoroughly what was going to happen the day of surgery. I booked my appointment, and yeah, so that's how I ended up at the hospital getting surgery. And everything went smooth. I got to the hospital. I got checked in. They called me back, get my vitals and everything. Eventually, I went to my room, and my nurse came in, and then the anesthesiologist came in and just, basically explained what they were going to be doing that day. The surgeon came in last. She gave a brief description of everything. I got sent downstairs or to a different floor to have some type of wire or something put in my breast before surgery so that they were able to locate the tumor without having any issues, basically. I want to say at the doctor's appointment that I had, when I got the biopsy done, they put a chip or something in my breast so that they were able to, whenever they go back on the ultrasound, I guess, to locate where they put that chip at so that they can find the tumor easily as well. I had a little wire hanging out from about right here. They covered it with a cup so that I wouldn't hit it on anything. And then before you know it, they were coming upstairs to get me. I remember, them transferring me onto the operating table. They're talking to me. They gave me the anesthesia. I was asleep. Woke up back in the room, and everything went fine. On a scale of 1 to 10, the pain, it really wasn't that bad. Honestly, the post-care, the post-feeling of surgery was similar to whenever I got the biopsy done. It was just very sore and tender. It didn't really affect my ability to do anything or slow down my daily activities or anything like that. I just had to be really cautious and careful. It didn't really affect me negatively in any type of way. It was just sore and tender. So I would give the pain on a scale of 1 to 10 about a 3 or 4. It really wasn't that bad. I am a week post-op today, and I'm still slightly tender. Not much. I just kind of have to watch whenever I'm asleep and stuff, or when I'm laying down, how I lay, because it can be a little uncomfortable. I still have surgical glue on the incision, so that has not completely come off yet. I say all that to say this. Please, when it comes to your health, advocate for yourself. Because Had I not been so persistent about constantly going back, following up, calling, pertaining to this issue, there's no telling what it could have turned into, or, you know, the mass could have got bigger, or whatever the case may be, because the first time that I went, they didn't see anything. But, okay, I had to come back because my camera stopped recording. But like I was saying, the first time I went to the doctor to see about this issue, they tried to rule it as galactorrhea, which clearly was not the issue. And then following that, there was no evidence of anything. You have to advocate for yourself whenever it comes to your health, because unfortunately, healthcare providers will blow you off and act like it's nothing, that it's not an issue. Especially with me being so young and having these type of concerns, to get blown off like that and then to come find out later on that there actually was an issue, that is scary. And I was terrified that maybe I had breast cancer because it runs in my family. And I could not stop worrying about it until I got an answer. I just couldn't. Camera keeps cutting off, but like I was saying, at the end of the day, nobody knows your body better than you. So you need to advocate for yourself whenever you know that something is not right. And I'm definitely blessed, definitely grateful that that was not the case, but that could have been the case. Do not think just because you're in your 20s that you cannot develop breast cancer or any other type of cancer because you're young. There are kids with cancer. It can happen to anybody. Definitely want to give a big shout out to the nurses, the doctors, the surgeons, everybody that helped me out in my patient care process whenever, throughout this whole journey. They did call me after surgery to let me know that they tested the tissue once again to make sure that there was no cancerous cells and that they got everything out. And so now I'm all good. I am going to go in a few weeks to follow up and, you know, just so that they could check and see how I'm healing and whatnot. But yeah, guys, that is pretty much it. I just wanted to share my experience because I just feel like this is not something that you hear about often. It's not talked about a lot. And, you know, it was kind of scary for me. So I hope that you all enjoyed the video. And if you haven't already, please like and subscribe, comment, and turn on your post notifications. And I will see you guys in the next video. Bye.
Let's not rush into it. When we get to it, we can give it all that we got.